Hello, everyone. Kaya Daniels in Nampa, Idaho. I was inspired to hop on and go live by one of my clients with MONAT. She is a cancer warrior. She has successfully beat cancer, and I am happy to say that she's doing well. So she inspired me to come on here and talk about hair loss. This is something that, according to the American Academy of Dermatology, it affects about 50 million men and 30 million women in the U.S., and up to 40% of women in America experience hair loss. It is normal to lose between 50 and 100 hairs each day. And some people, when they're experiencing hair loss, normal hair loss, are concerned about that. If you can imagine going through chemotherapy or other medication-induced hair loss, that number can go up considerably. And a lot of people can experience up to 150 to 200 hairs a day of hair loss. So it can have a big impact on how you feel about yourself, your confidence, and of course, no one wants to lose their hair. So I want to talk about a lot of the different medications that we take on a daily basis that can cause hair loss. It's pretty crazy. I had no idea. Hi, Danielle. I'm sorry, but I got to turn those comments off because I'm looking at this instead of paying attention to what I'm doing. So swiping the comments away for now. So one of the reasons why she inspired me to come on here is because she was so impressed with how fast her hair grew back after chemo using MONAT. And she is not the only one. I have several clients that are either cancer survivors or they use medications for other reasons that have hair loss, hereditary hair loss. And I want to talk about how MONAT helps with those hair loss types. So let's talk about what MONAT does. So excessive sebum on your scalp, which is the buildup of oils and your natural skin cells, can accompany thinning hair. It's usually because of an inflammatory response in your body. MONAT has 7 treatment systems that have been formulated with these special ingredients that help combat hair loss. So Capixul is actually a red clover extract. It aids in hair regrowth and maintains a well-hydrated scalp. It can boost stronger, thicker, and healthier hair. Clinical data. So MONAT hired an outside independent contractors to do clinical studies on the ingredients in MONAT and their effect on hair loss. So, where was I? So the clinical data from those studies shows that it improves alopecia, which is also just another word for hair loss, by increasing the anagen to telogen ratio. It keeps the hair growth period longer and shortens the resting period. So the anagen period is the growth period and the telogen is when it rests. Hair grows approximately 3 millimeters a day, and that's it. So this clinical study showed a clear increase of 46% on the growing hair density of the volunteers using Capixul versus placebo after 4 months of use. The study also demonstrated an improvement in repair effect, improving hair anchoring. So hair anchoring is your follicles and how well they stay attached to your scalp by 70%. The study also demonstrated a substantial reduction in the DHT hormone. So DHT is a byproduct of testosterone. So depending on your levels of a male or female, you can have hereditary baldness caused by this hormone. And the more that we age, the more that we produce. What it actually does is causes those follicles to shrink and eventually become dormant. It's crazy, but it is what it is. That's nature for you. So the study also demonstrated that there was it was reduced by 48%, that DHT hormone. Capixul prevents and stops the hair loss process and stimulates hair growth. Clinical studies have demonstrated better results in hair growth stimulation than other products out there that are harsh chemicals and are not naturally based. I'm not going to name names. Another ingredient that MONAT has that's proprietary to MONAT is called procataline. It's a pea extract. It's a high-tech blend that supports the appearance of healthy, younger-looking hair by helping to protect your tresses from environmental factors. So, for example, the sun. Living here in Idaho, I can tell you the sun is a huge factor for me in not only my skin on my face and my arms, but also on your scalp. You can get sunburned on your scalp. So, What procalcitonin does is it creates an environment favorable to hair growth and renewal. It preserves hair cells and increases the hair follicle strength, again, anchoring by 35%. It preserves hair follicle structure from the damage, and it increases the collagen production, directly increasing the size of your hair follicles by 70%, which is pretty amazing. It preserves the melanin in your hair follicle under these stresses. So that means that it's going to help keep your hair from lightening. And also if you have gray hair or blonde hair, these ingredients keep your hair from turning brassy. So the other ingredient I want to talk about is called Crotosorb. It's a powerful ingredient that helps preserve the natural pigmentation of the hair. Again, keeps it from lightening. It also protects the hair and the strands, the integrity of the cuticle and the cortex of your hair, preventing photo damage, which can cause that brassy appearance. So the last ingredient that I want to talk about, and this is their main proprietary ingredient in all of their hair and skincare products, most, I should say, of their hair and skincare products. It's called Rejuvenique Oil. It is an obsidian-based oil that is a natural hair conditioning agent with numerous benefits. In fact, I have a worksheet or a PDF sheet I can give you if you want that lists over 101 uses for this oil. It's pretty amazing stuff. So the base of this oil is obsidian, and it increases the manageability of the hair. So it strengthens and makes it more resistant against stresses like brushing your hair, so it helps to keep it from breaking. It's effective shine enhancer without being greasy. In fact, I use this on my scalp, especially this time of year, to prevent it from getting too dry, and I sleep in it. And I wake up in the next morning and it's not on my pillow. Stuff's pretty amazing. It's kind of known as a dry oil. So these benefits can be seen on different hair structures. So, Caucasian hair, mulatto hair, and different ethnicities all can benefit from this oil. It is used as a natural replacement for other oils and hair care applications, and it's great for replacing those synthetic ingredients that you don't want to use, like silicones and mineral oil, which actually suffocate your hair shaft and cause more damage than they do help your hair. So, talking about medications and hair loss. So what those medications actually do is they interfere with the normal cycle of your scalp hair growth. So during the anagen phase, which lasts 2 to 7 years, the hair grows. During the telogen phase, which lasts about 3 months, the hair rests. At the end of that resting phase, the hair falls out and is replaced by new hair. Medications lead to 2 types of hair loss. One is where it actually causes the hair, blocks the hair from being in that growth phase, which is where the hair follicles become dormant, or the anagen phase, which just causes it to be in that, I think I just switched those, but that's okay. Yes, no, I did it right. In the anagen phase, which is the growth period, so it can actually stop it from growing. So telogen is the most common form of drug-induced hair loss. It appears within 2 to 4 months of taking the medication. This causes the hair follicles to go into their resting phase, become dormant, and fall out too early. So people with that type of hair loss usually shed between 30 and 70% more than the normal 100 to 150 hairs a day. So that the anagen hair loss is when that growth phase of the hair cycle, when the hair actively is growing, it prevents the matrix cells which produce new hairs from dividing normally. So this usually occurs in a few days after taking the medication. Most people who are taking chemotherapy drugs for cancer often will see a severe form of that hair loss. It causes them to lose not just the hair on their head, but they lose their eyelashes, their eyebrows, the hair on their arms, as well as other parts of their body. The severity of the drug hair loss depends on the type of drug and dosage, as well as sensitivity to that drug. So what types of drugs can cause hair loss? This blew my mind. Because I use these. I mean, a lot of these we've all used at some point or another. So this is kind of crazy. Acne medications containing vitamin A or retinoids, antibiotics and antifungal drugs, antidepressants, birth control pills, anti-clotting drugs, anti-rejection drugs given after a transplant, cholesterol-lowering drugs, drugs that suppress the immune system, drugs that treat breast cancer and other cancers, epilepsy drugs, also known as anticonvulsants, hormone replacement therapy, mood stabilizers, nonsteroidal anti-inflammatory drugs. Okay, That's like ibuprofen. That's what an NSAIDs are called. Parkinson's disease drugs, steroids, thyroid medication, weight loss drugs. Those are just some. So you can do a quick Google search of medications that cause hair loss, or you can read the side effects on many of these drugs, and it's in there. So a little bit of information for you about how MONAT helps to combat hair loss, what different types of medications that we're all using that can cause hair loss. Other types of hair loss obviously are stress. I know this has been a very stressful year for most of us, and that can also cause hair loss. Hereditary baldness, I touched on that a little bit in here. So if you or someone you know are suffering from hair loss and would like some information on how a simple shampoo and conditioner can change that and help to regrow your hair or prevent hair loss, let me know. And I look forward to talking with you. Have a great day. Happy New Year, everybody.